An abdominal aortic aneurysm is a medical condition characterized by the abnormal dilation or bulging of the aortic artery, specifically within the abdominal segment of the aorta. The aorta is the largest artery in the human body, responsible for carrying oxygen-rich blood from the heart to various organs and tissues. When a portion of the aortic wall weakens and expands, it can result in the formation of an aneurysm. Abdominal aortic aneurysm typically develops slowly over time, often without noticeable symptoms, making it a potentially life-threatening condition if left undiagnosed and untreated. The underlying causes of abdominal aortic aneurysms are multifaceted. One primary contributor is atherosclerosis, a condition characterized by the buildup of plaque within the arterial walls. This plaque buildup can weaken the structural integrity of the artery, predisposing it to the formation of an aneurysm. Other risk factors include high blood pressure, smoking, advanced age, and a family history of aneurysms. While the exact mechanisms leading to abdominal aortic aneurysm formation are not fully understood, these risk factors collectively contribute to the gradual deterioration of the arterial wall. Symptoms of abdominal aortic aneurysms can vary widely depending on the size, location, and stability of the aneurysm. In many cases, individuals with small aneurysms may remain asymptomatic for an extended period, only to discover the condition incidentally during routine medical examinations or imaging studies. As the aneurysm enlarges or approaches rupture, patients may experience symptoms such as persistent abdominal or lower back pain, which can be severe or throbbing in nature. In cases of rupture, patients may present with sudden, intense abdominal pain, often described as tearing or ripping, accompanied by symptoms of shock such as dizziness, rapid heartbeat, and a drop in blood pressure. A ruptured abdominal aortic aneurysm constitutes a medical emergency, requiring immediate intervention to prevent potentially fatal hemorrhage. Diagnosing abdominal aortic aneurysm typically involves a combination of medical history assessment, physical examination, and imaging studies. Healthcare providers may palpate the abdomen to detect the presence of a pulsatile mass, although this method is less reliable for smaller aneurysms. Diagnostic imaging modalities such as ultrasound, computed tomography scan, or magnetic resonance imaging provide detailed visualization of the aorta and aid in determining the size, location, and characteristics of the aneurysm. Routine screening for AAA is recommended for certain high-risk populations, including older adults with a history of smoking, as early detection can facilitate timely intervention and reduce the risk of complications. Treatment options for abdominal aortic aneurysms vary depending on factors such as the size of the aneurysm, its rate of growth, and the patient's overall health status. For smaller aneurysms that are stable and asymptomatic, a conservative approach involving regular monitoring through imaging studies may be recommended to track any changes in size or morphology. Larger aneurysms or those at risk of rupture may necessitate surgical intervention to prevent catastrophic complications. Traditional open surgical repair involves surgically removing the weakened portion of the aorta and replacing it with a synthetic graft, whereas endovascular repair utilizes minimally invasive techniques to deploy a stent graft within the aorta to reinforce its integrity. Complications associated with abdominal aortic aneurysms primarily revolve around the risk of rupture, which carries a high mortality rate if left untreated. A ruptured abdominal aortic aneurysm results in massive internal bleeding, leading to hemorrhagic shock and potential organ failure. Blood clots may form within the aneurysm, increasing the risk of embolization and occlusion of vital arteries supplying blood to the lower extremities or other organs. The presence of an aneurysm can compromise blood flow to adjacent structures, potentially causing ischemic complications such as kidney dysfunction or intestinal ischemia. Preventive measures play a crucial role in mitigating the risk of abdominal aortic aneurysms and their associated complications. Lifestyle modifications, including smoking cessation, adoption of a heart-healthy diet, regular exercise, and management of underlying medical conditions such as hypertension and hypercholesterolemia, can help reduce the progression of atherosclerosis and lower the risk of aneurysm formation. Routine screening for abdominal aortic aneurysms in high-risk individuals enables early detection and intervention, thereby improving outcomes and reducing mortality rates associated with ruptured aneurysms. An abdominal aortic aneurysm represents a significant vascular pathology characterized by the abnormal dilation of the abdominal segment of the aorta. While often asymptomatic, abdominal aortic aneurysms poses a substantial risk of rupture, leading to life-threatening hemorrhage and other serious complications. Timely diagnosis and appropriate management are paramount in mitigating these risks and improving patient outcomes. Through a combination of risk factor modification, routine screening, and prompt intervention, healthcare providers strive to optimize the care and prognosis of individuals affected by abdominal aortic aneurysms.